Looking to take your financial knowledge to the next level? You're in the right place. Welcome to Ask Ralph, offering accounting, technical, and financial advice. Whether you're looking to save taxes or improve your business, he's got you covered. Here's your host of Ask Ralph, Ralph Eastup Jr.
I thought today I'd talk a little bit about some of the alternatives to the Affordable Care Act. With it being the enrollment season, it's a good time to talk about another option. And I can speak with some intelligence about this because my family and I decided about a year ago to move into this type of plan instead of the traditional healthcare plans because of the cost. And one of these things is called a healthcare sharing ministry. And it's a faith-based program that's designed to pool members' money to share their medical expenses. Now, these type of programs exempt taxpayers from the Affordable Care Act penalties so long as they were set up before December 31st, 1999. Now, these programs work. They require members to make a promise to adhere to certain biblical values and to participate regularly in worship or prayers. As a result of this, some of the health conditions don't comport, and they don't cover some of the things that people of religious would find to be objectionable. These would include such things such as tobacco, alcohol, and drug addiction, and generally don't cover mental health services, contraceptives, or abortion. But the big difference is just an absolutely lower cost. So I thought I'd take a few minutes and talk to you about, what are the specific components to these. And the first thing I want to say is these are growing because of the fact that the cost of traditional health insurance continues to climb. I know in my personal situation, we had been on traditional health care and the annual costs increased by 20 to 30, sometimes 35%. And it just became an attractive thing to look for other options. Now, we didn't want to be in a position where we didn't have insurance. So we looked into the Medishare, and actually we went with a company called Liberty Health Share. But there are several different ones. The first thing you need to know is it's not health insurance. They're designed to help cover the cost of medical expenses, but they differ in that it's really a situation where each healthcare sharing ministry operates by collecting members' money, and in each month that's placed into account and they're shared among the members. Now, it sounds kind of strange, but like I said, I've been involved in this personally. And it operates a lot like insurance in that they come up with a premium that you pay, or what they call your sharing amount. And then that money is shared between the members. Second thing you need to know about these are state and federal regulations don't apply. So because it's not insurance, you need to know that if a claim is not paid or if there's some argument about it, you don't have the ability to go to the state's insurance department and fight about this. Now, that being said, there are situations with all of the healthcare coverage, the ministry sharing, where they have appeals processes. And I knew someone that had a simple example of this, and they were given a bill from a local hospital, and that bill was negotiated down as normal insurance companies would do, but the health ministry did the same thing. And this particular hospital would not accept the negotiated down amount. So this particular person that I'm talking to, they were able to appeal this. And even though the hospital wouldn't pay or wouldn't accept the lower amount paid, the health ministry stepped up and paid it different. So, but you do need to understand that the state and regular insurance, state and federal regulations do not apply to these. One of the reasons that it's able to be offered at such a lower cost is that they do allow underwriting. Now, prior to the passage of the Affordable Care Act, insurance companies were allowed to regulate or write an insurance policy based on pre-existing conditions. Now, with these medical ministry sharing situations, they are able to use underwriting, and they can exclude pre-existing conditions. I know the one that my family uses, they exclude pre-existing conditions basically for a 2-year period. The first year they have no benefits for a pre-existing condition, and then the second year there's reduced benefits. But if you're a person who doesn't have any pre-existing conditions and you're looking at an option that would be more affordable, this is certainly something to look at. Another thing I want to bring to your attention, there are limits to coverage. Unlike health insurance, there are generally limits to the amount of medical expenses healthcare sharing ministries will cover. In some cases, a maximum payout of $125,000 per incident and $1 million per diagnosis. And this just comes down to buyer beware. You need to read the fine print. I know that the particular company that we work with, Liberty HealthShare, has different plans based on how much you're desiring to have as your limit. And the thing you also need to know is that because it's a shareable expense, all of them will clearly tell you that there is no guarantee that these things will be paid. So I know when I was looking into this, one of my main concern is, well, what happens if for some reason nobody pays their share of their required share per month? Well, then, yeah, that could happen. But one of the things I will tell you, being an accountant, I did some due diligence in this, and you can actually look at the ministry sharing sites, and you can see the amount of money that's coming in, the amount of money that's going out. So I feel like this is an area you need to be concerned about, but not necessarily something that needs to be a make or break decision point. The thing that really is the benefit to this is there's no limit on access to doctors and hospitals. One of the things that a lot of my clients will tell me is that I'm really frustrated with having to change my doctors. And we can get into a whole political discussion about how you can keep your doctor. And I think we all know the truth about how that played out. But one of the main positives about the ministry health sharing is that it's really a good deal for both the physicians and the patients as well, because it effectively becomes a cash payment on the part of the physician, so that most physicians will take these plans. In fact, there's an article that I read in preparation for this particular thing, and it's called Healthcare Sharing Ministries: A Leap of Faith. It's from healthinsurance.org contributor Lisa Zamosky, and it's dated July 19th, 2016. And one of the things that they stated here is, according to Bellis, and that's somebody they mentioned here as a contributor, 97% of all doctors and hospitals take the reimbursements they negotiate. So this is really an area where you can see a great deal of savings. And like I said, in my personal situation, we went from about $2,200 a month premium with a $7,500 deductible down to about a $600 premium with a $1,500 deductible. So it was a substantial cost savings. Now, of course, you have to realize that it doesn't cover everything. It doesn't cover some of the things that traditional insurance would cover. But it really comes down to a dollars and cents discussion. And, I'm providing this information to my listeners because I really feel like with the cost accelerating for health insurance, it's something you might want to look at. So feel free to send me any questions or comments about that issue at AskRalph@AskRalphMedia.com.
You've been listening to Ask Ralph, brought to you by Saggio Accounting Plus. Please subscribe to and rate our podcast on Apple Podcasts or wherever you get your podcasts, and leave us a rating and review. Our podcast is produced by Carolyn Peters. Thank you for listening, and be sure to like us on Facebook and follow us on Twitter at Ask Ralph Media. You can also hear me each week on 1450 WILM and on 1410 WDOV in Delaware, and on the iHeartRadio app. Submit your questions or ideas for future shows by sending an email to AskRalph@AskRalph.com.
The information contained in this episode of Ask Ralph is based on data available as of the date of its release. Saggio Accounting Plus and Ask Ralph Media Inc. is under no obligation to update this content if changes occur. Applying this information to your specific situation requires careful consideration of all facts and circumstances, and any information provided is not to be considered as financial, tax, or legal advice. Please consult your tax advisor or attorney before acting on any material covered.